Okay, good afternoon, everyone. We're going to go ahead and get started. My name is Alicia Johnson, and I'm Public Information Officer for this incident. And I'm very happy that you're all here today. And I'd also extend a big thank you to all of our folks who are participating in today's conference, especially on such short notice. Today's goal is to provide a collaborative opportunity for the incident command from the Missoula City County Health Department, as well as our local government and elected officials and our schools to provide information on COVID-19 and to give them an opportunity to answer questions. Today's messages will include current actions and future planning on COVID-19, risk reduction activities for citizens, particularly those at high risk, and we'll talk about how to prepare for the disruptions that may accompany a pandemic disease. For today's list of events, I will go through the order of speakers. Each person will have a brief amount of time to address everyone, and then at the end, we will open things up for questions. Our order of speakers today: Ellen Leahy, Health Officer from the Missoula City County Health Department; Ross Miller, Chair of the Missoula City County Board of Health; Cindy Farr, our Incident Commander; Mayor John Engen; Commissioner Josh Slotnick; City Council President Brian Von Lossberg; Superintendent Rob Watson from the Missoula County Public Schools, and President Seth Bodner of the University of Montana. With that, I'll hand it over to Ellen.
Thank you. I want to thank all of my colleagues up here for all the support and getting to this meeting today, this press conference today, and all the future support that I know that we all can rely on. I also want to thank the members of the media who have been very consistent, up-to-date, and in my experience, accurate with the information that our citizens need. I'd like to just in general say that there are things about pandemics that are the same with every pandemic, and then there are things that are different. So, for example, in this pandemic, we know who is most at risk to get seriously ill. And while that is tragic, that is the minority of cases, and yet we need to protect those folks, and we need to protect the people in the healthcare setting that can help those folks. Very important incident goals. We know that most that get ill will have a milder, may not feel mild at the time, but a full recovery. And we don't know how many may be affected and never show symptoms, and we actually don't know their actual level of contagion, so we have to be cautious with that. But there's one thing about pandemics that will affect and is affecting all of us, and that is the daily disruption of your life. That is a huge disruption, and no one will escape that disruption. So what we are all trying to do, and you've seen it voluntarily being done all over the country, and you're seeing it right here in the community, is let's talk about that disruption, how you can manage it, and how, and sometimes why it's there, and why it's being managed a certain way or not a different way. So we won't be able to answer all those questions today, but we're in it now. We're in the disruption now, even without a positive case. I'm sure you're all aware that one of the main management tools of a pandemic when it actually hits is you get a big curve of cases. Why? Because we are all theoretically susceptible. With this one, you don't see the cases until people are really sick. So we are aware that there are unseen cases out there, and we'll talk about that with the testing availability later. One of the main management tools is to take that, what would be just a completely uncontrolled huge curve with respiratory, almost a spike, and to try to flatten it. Does that mean that we've stopped the spread or less people ultimately get sick? Not necessarily. But it gives us all a better way to manage the disruption in our essential services, in our lives, especially when we don't know how long it will last and how long we could sustain certain closed down or tamped down activities. And one of the most important goals, as I mentioned earlier, is we have to support the healthcare system. So right there, we have some competing goals. There are certain things that if they need to close, for schools, for example, that should happen using evidence in a time and at a way that is absolutely warranted and feasible. Otherwise, we have not protected our healthcare facilities. So we have competing goals here that have to be balanced out. Well, I'd like to talk about some of the voluntary changes that people are already making. I couldn't put butter on my free slice of bread this morning, and I said, thank you very much for taking that knife and that away from me. I also learned that a large concert that a lot of people younger than me wanted to go to, that organizer at expense has canceled that. Those are voluntary, very good and helpful ways to be a good citizen, something that little to something that big. And Cindy will talk more about what kinds of things you want to look at when you make those decisions. We're going to stay away from making all those decisions for you until such time they absolutely become necessary. But we are learning that even though the guidance is out there on how you can tailor protections in your own workplace, that people sometimes have trouble implementing it. And you'll see examples of the city and the county, for example, implementing it for the city and the county. And they look different, and they're both good. They will both work. So we encourage that. We also know that there's a lot of questions about events and travel. We are largely following the CDC guidelines for travel, but if you have a high-risk person in your family or in your business or your club, again, that's where you want to carefully look at the guidance or call our 258 info line to see if the way you plan to implement it is the best protective and the most feasible. But we can't answer that without your input of what works for you. So thank you for everyone who understands that and takes the initiative on their own. There are instances where large-scale quarantine or stopping events and congregation could be ordered. But again, the more the voluntary things with good guidance happen early, the less likely that we have to go into that mode. We will use evidence, and that evidence will be based on the evidence of spread in the community. And we're going to be getting better evidence of spread in the community as we know now the testing will become more available to us. A couple of specific examples that are more local that we've been working on. I am in a group with 6 other local health officers in the 7 most populated counties in the state. And in our jurisdictions, of course, the largest percentage of the population resides. We have been working on school closure issues and on sports events and other messaging for large scale. Yesterday, we unanimously took an action to write, and in concert with the Department of Public Health and Human Services, not in a way that takes away local adjustments, but to try to not have so much confusion and varying responses across our state, which is confusing for people. We issued a recommendation from all 7 of us through the Department of Public Health and Services to the Montana High School Athletic Association that it is in the interest of the public health and to prevent the transmission of infectious disease as well as fairness related to these sporting events that all spring 2020 sports seasons, games, and tournaments be canceled. We've not heard back on that. We have also worked to try to get as much on the same page initially with school closures, and we have issued actually a draft, but it's not going to change much. We have issued a similar statement from the 7 of us to the State Health Department that we think is consistent with CDC guidance, allows for local decision-making, but we are recommending, and we intend to practice, that if there is a case in the school, could be staff, teacher, student in the school, we will work with that school, but likely initiate only in that school a short closure so that the health department can get in, find out who may have been exposed. It's going to be different in every school setting. Work with the school to make sure that high-risk students are identified, do anything that that school and that population needs to do. But that would be the purpose of those closures. With that, thank you. That's where things stand right now in our state.
Hello, my name is Ross Miller. I'm the chair of the Missoula City County Board of Health. I'm going to talk about our community's quarantine and isolation policy. Federal and state law requires that the Missoula City County community have a quarantine and isolation policy. Our policy is based on and supported by those federal laws. It is consistent with and in compliance with all federal and state laws and requirements and guidelines. Therefore, it's quite similar to the quarantine and isolation policies throughout the country and other communities. The quarantine and isolation policy outlines when and under what conditions quarantine or isolation is warranted. Quarantine is used for those who have been exposed to an infectious or communicable disease until such time that we know the person did not become sick and infectious to others. Quarantine can be implemented either by voluntary request or it can be ordered. Isolation is then for those who become ill with an infectious disease. It also can be implemented either by voluntary request or by order. Our quarantine and isolation policy is current and in compliance with all laws. It was updated last in February of 2019. Our quarantine and isolation policy authorizes the health officer, Ellen, in our community, to use the policy and provides due process for people that may be affected. It asks first for quarantine or isolation as to be voluntary as a first step, but then it does provide for a mandatory order from the health officer should that become necessary to protect the public from the spread of an infectious or communicable disease. The Missoula City County Board of Health is comprised of 7 members appointed by the City Council and the County Commissioners. As chair of the board, I've signed the quarantine and isolation policy with the consent of the full board. There is by the end of the day today, there will be a link to the quarantine and isolation policy available on the Health Department's COVID-19 website for anybody who wants to actually read the full policy. Thanks.
My name is Cindy Farr, and I'm the incident commander for this COVID-19 outbreak. So I just want to expand a little bit on what Ross was talking about with the quarantine and isolation and how that is actually operationalized in our office. Right now, we don't have any cases in Missoula County, but we know that that is probably going to change in the foreseeable future. So what we are doing in our office is when someone identifies to us that they have been a contact to a case or they have had travel to an area where we know that there's been a lot of spread, we ask those people to self-isolate and essentially quarantine for the 14 days of the incubation period for this disease. Our nurses are checking in with them daily to check to make sure that they're not having a fever over 100.4, that they're not having any shortness of breath, and that they do not develop a cough. If they do, at that point, we ask them to go call their healthcare provider, and we assist them in getting in to get a test done, so that at that point we can figure out if this is actually what they have. Once we have cases that come back positive, we will be asking those people to isolate themselves so that they don't spread the disease to other people, and they will have to be isolated until we have 2 negative tests. Sometimes that might be as short of a time period as a couple of weeks, and it might be as long as 6 weeks. It just depends on how severe the illness of the person. So that's how we operationalize the quarantine and isolation procedures. I know that there's been a lot of questions about testing. Testing just this week has become much more available in our state and in our community. We do ask people to call their doctor and find out if they should come in to get a test. The doctors are then having to rule out other common respiratory diseases. Many of you know, and we've been saying, we are still in the middle of flu season. We're seeing a lot of flu. So we want the providers to be able to rule out the disease that we are seeing a lot of before we start running tests for this disease that we have not yet seen. As that becomes more available, we are going to start seeing more cases. The things that we want the public to know is that there are things that you can do to protect yourself. If you fall into the high-risk category, and that would be people over the age of 65 with chronic conditions, people under the age of 65 who have chronic respiratory conditions or are immune compromised, Consider not attending large events. Make sure that you are doing all of the things that we always say every flu season. Wash your hands, cover your cough. Don't shake hands with other people. Try not to be around people who are sick. But you want to take care of your own health, especially if you do fall into those high-risk categories, to make sure that you are removing yourself and doing what we call social distancing from any situation where you could potentially be exposed. We know that a lot of businesses and workplaces are trying to help identify those people who could be at a higher risk and making accommodations so that they remove themselves from a situation where they could be exposed. If you do not fall into those high-risk categories, we still want you to do the things that you can to protect that vulnerable population. And that does include washing your hands, covering your cough, making sure that you're using hand sanitizer if you don't have soap and water available. While I know that hand sanitizer is flying off the shelves right now, it is still important that if you have it, use it. So those are the ways that we can protect other people in our community that may be at higher risk of developing severe disease from this.
I'm John Egan, Mayor of the City of Missoula. Again, thank you all for being here today. We appreciate it, and we appreciate your help in conveying these important messages to the community. A couple of things that you need to know from the City of Missoula's perspective. One is that we're operating under a business continuity plan today, and that plan is designed to get us from soup to nuts, depending on the duration and severity of the pandemic. But what folks need to know is that we will continue to provide the essential services that are necessary for the City of Missoula and this community to continue to operate. You are going to see first responders responding in the ways that they always have to emergencies. You will see us continuing to emphasize public safety. We will continue to maintain facilities. And we've taken some steps already to not only protect those vulnerable individuals who are employed by the City of Missoula, but we're taking additional steps. As Ellen suggested, there will be disruption. Disruption for us will largely be inconvenience. What you'll likely see at the City of Missoula, and in some cases already see today, you're not going to go to the finance window to pay your bill. We're going to ask you to mail it or conduct that transaction or online, or drop that payment in a box. We are likely not going to send an employee into your home to install a water meter, because that is not a critical issue today for you. So if it's not emergent, we're not going to be in your home, generally speaking. But we are built and equipped, and we have planned and prepared to continue to deliver those services that folks absolutely need in our community. What goes missing until there is a critical issue such as this one is the fact that our partners plan relentlessly for events just like these. It's not very sexy, it doesn't get a lot of coverage, but that planning and that preparation really comes into play today. You see the incident command structure, you see the communication tools that are available, and we're continuing to refine those based on emerging evidence and guidance that we're receiving every day. This is a very fluid situation, and I can tell you from the City of Missoula's perspective, we have all hands on deck, and we're also communicating pretty relentlessly with our partners, and new partners are coming on board all the time. We're very interested in the feedback that we're getting from the frontline healthcare providers in our community, and how we can cooperate and support those healthcare providers to ensure that people who need critical care are getting it, that we're screening appropriately, that we're testing when necessary, and managing to control, to the degree that we can, that curve. A couple of things to note. One is, if you are a private business or even at a family level, you can do some planning of your own. Our plan is specific to us, as Missoula County's is to that institution, but all of us can do that planning and take precautions. And finally, I think what you heard from Cindy and what you're going to hear relentlessly here is that that personal inconvenience, that slight change in your lifestyle could make a huge difference in the community. So there are going to be lots of opportunities to make choices around how you engage in the community. And this is a time to look at those choices. And sometimes the choice is to stay home. Sometimes the choice is to cancel an event. There are a lot of ways that we as individuals and organizations throughout our community who do good work every day can improve that work in a time of necessity. I trust that we're going to get through this just fine, but it won't be without bumps. It won't be without consequence. But we are prepared, and I'm confident that working together, as Missoulians always do, we can ride this out in a way that we can be proud of when the dust settles.
Thanks. I'm Josh Slotnick. I am a Missoula County Commissioner. I'm currently the chair of the Missoula County Commission, but sometimes, like today, I feel a bit more like an ottoman than a chair. You might say, how could I make a joke at a time like this? And I'm intentionally making a joke to pass on that we will get through this. Life will go on, and it's all right to laugh and make a joke and be ourselves, even in a time of moderate crisis. Like the other electeds and government officials and educators, et cetera, at this table, we provide services, and we are going to continue to provide those services. And we have a responsibility to those receiving those services, and we also have a responsibility to those who we employ, the 850 folks who work for Missoula County, who do the work of providing those services. So we are asking our other Missoula County electeds and department heads to begin to work on changing plans on how we do that service delivery and how we protect the most vulnerable of our employees, those who are older or fit the categories that we all know about, or who have those same folks within their home. As the mayor said, everybody can do something like this within all of your workplaces. And each plan will be a little bit different, specific to the folks who are involved. And we can do this. There's a bit of an irony here. It just jumped into my head. Working together, we can remain apart. That's what we'll do.
Thanks, Josh. It's really good to sit next to you. Chair Ottoman. My name is Brian von Lossberg. I'm the president of the Missoula City Council. Some of my colleagues are here as well. I appreciate that. Our second grade daughter, Austin, regularly reminds me to breathe and practice mindfulness. That's good advice from a young, wise soul, and I think it's a good place to start. She also told me in no uncertain terms how upset she would be if I did not relay specific hand-washing instructions complete with song options and proper duration. I'm not going to use this opportunity to do that, but Superintendent Watson, I want to confirm, I can confirm that your staff is doing excellent work on that front. My wife and I are constructively critiqued on a daily basis or hourly basis. I also want to thank constituents who have reached out with offers of help, information, suggestions, etc. Missoula is a passionate, engaged, resourceful community, and we're better for that, and we're going to emerge, as others have said, from this experience, better for that as well. My colleagues and I are listening, and we hear you. Ellen and others have spoken about disruption, and I want to come back to that. I think it's important to acknowledge that this can be a dislocating and a dizzying experience when events move so rapidly, when the routines of daily life are upended and turned upside down. And it's certainly been that way for me and my family, and we're going to see more of that in the days and the weeks ahead. So understand you're not alone in feeling those things and feeling that way. But I think it's important to highlight two things from that disruptive and dizzying experience. The first is that the responsible actions that organizations are taking to promote social distancing, which is a term we're all hearing a lot and you're going to hear a lot more of, those are a cause for optimism. And that may seem a bit odd, but I would argue that they are a definite cause for optimism. Organizations, big and small, here in Missoula, statewide and nationally, through their leaders and their staffs, are taking this seriously and doing what they can to limit interactions that facilitate the spread of the virus. And those are all responsible things to do. The university has taken those actions, the city and the county have taken those actions, as Josh and the mayor have described, and I'm seeing organizations and information from organizations all over town. I just saw something from the Roxy Theater, really proud of the actions they're taking on their front. So that brings me to the second thing I would emphasize. This is an opportunity for empowerment and resolve and action. Day in, day out, Missoulians rise to challenges, big and small. Sometimes those are daily challenges, sometimes they're challenges that span years. We support an incredible number of organizations across the community, the Poverello Center, the YMCA, the YWCA, the Food Bank, et cetera, et cetera. This community gives generously to those organizations. Continue to do that. Reach out to your neighbors, practicing good social distancing, and help those folks, not just the neighbors that live next to you, but all of the folks around you. We have a great tradition in the city and in the state of doing that, and this is an opportunity to continue to do that. I'll simply conclude by saying I love this city. We all do. It's a community, as I said, filled with passionate people. It's a community that values science and a community that knows how to come together to help each other. By working together, we can protect our loved ones and our neighbors. It's time for all of us to sacrifice a little to help everyone a lot. Thanks.
Good morning, everybody. For those I haven't met, I'm Rob Watson, the Superintendent of Schools for Missoula County Public Schools. I have just a few things to discuss. I wanted to discuss briefly on what we've already done to prepare, and also some restrictions that we're going to put in place after spring break. To be clear, we are on spring break this next week, so we won't have any schools open next week. Briefly, what we've already done, and I think our staff has really stepped up and taken our advice and worked through some of this stuff. So as was mentioned, we've increased our protocols around hand washing, as well as wiping down frequently touched surfaces. We know that those things both help stem the spread. We've also asked our teachers to begin to prepare for school closures should we get to that point. One of the ways they're doing that is using learning management systems for remote or online learning and setting those up. We've also discussed at the district level how we might prepare for school closures should that come to be with regards to delivery of really critical services like our school lunch program. And other services that will need to be delivered in the event of closure. So we have taken some steps in preparations and planning for that. The other thing I wanted the community to know is that we don't operate in a vacuum. We've had several opportunities to increase our communication, not only with our local partners here at the table, but also with our state partners. I was on a call this morning with the Office of Public Instruction, who's giving guidance for all schools in the state of Montana. I know that we have members that represent schools that are sitting on the governor's task force around this issue. I spent most of the day yesterday in calls with the AA superintendents around the state talking about protocols that they're doing in their communities. So I just want to make sure folks understand that these decisions are not made in a vacuum. I want to talk briefly about school closure. Please understand that student safety and safety of our staff is our top priority for us in the school district. We also are part of the community. We recognize that we play an important part in the community, and actions that we take will impact our community. We have not received any specific guidance, orders, or instructions to close schools after spring break. In fact, to the contrary, what we received this morning from the guidance from the Centers for Disease Control was really about, am I getting feedback on this? My fault. Sorry. What we received this morning from the Centers of Disease Control was really guidance on when to consider district-wide closing. We're not at that stage yet. However, we know we could be there very quickly the way that this is evolving. That's why we're preparing for it. So we'll take direction from the local county health department as well as from the governor's office should we need to move to district-wide closing. Having said that, though, we are prepared to do short-term closing, as was described by Ellen. So should there be a case of student or staff that's confirmed, we will move to a short-term closure at that school for 2 reasons. And again, this just involves that school. The first reason is for cleaning of surfaces and cleaning of school. But perhaps secondary and more importantly, that short-term closure, 2 to 5 days, which is being recommended by the CDC, would allow for the local health department to identify close contacts and to stop the spread among students if they were to come back to school. So we do support that, and we will move to that fairly quickly if needed. But again, that's only after there's a confirmed case of either a student or staff member at that school. The last thing that I wanted to mention, and I'm going to read these because they're fairly specific, but we are taking steps, sort of self-restriction steps after spring break. So all of these will take effect starting March 23rd. We have already prepped for this in a few instances, but we will cancel, postpone, or suspend all out-of-state school-sponsored travel for both staff and students. We will do this for March and April, and then we'll reassess for May and June. So that covers out-of-state travel for staff or students. We will also suspend, cancel, or postpone any school-sponsored activities that involve community members in attendance. We believe that there is a potential for spread, obviously, among community members. We want to be sensitive to that. We know that there's community members that have compromised immune systems for a variety of different reasons. We want to take our part in making sure that we're not part of that spread. So for that reason, we're going to suspend, cancel, or postpone any school-sponsored activities that involve community members in our schools. Again, this will happen for March and April, and we'll reassess for May and June. This means concerts, plays, other activities that bring community members together. It may also include any activities that are sanctioned by the Montana High School Association. That decision is a little bit outside of our control. That will need to be made by the Montana High School Association. And finally, we will suspend, cancel, and postpone activities during the school day that bring large groups of students together unless absolutely necessary for the function of the school. And that's really important that the community hears that, because we have activities during the school day, like school lunch, that bring students together, large groups of students together, that is necessary for the function of the school. So there will still be some activities during the day, school lunch. We have a ACT test coming up for all juniors. Those activities we will need to bring students together. But any activities that are not essential to the function of the school, for example, school assemblies, we will cancel, postpone, or suspend those activities for March and April. The last thing I would say is we sent this message to our staff this morning. None of these decisions are taken lightly. Many of our students have worked very hard to prepare for some of these activities, as you can imagine. We needed to take our time on this decision. We think this is the right decision. We will hope that we can postpone some of those activities for a future date. Thank you.
Good morning, everybody. My name is Seth Bodden. I'm the president at the University of Montana. And, I start following Rob just by emphasizing that, the considerations for a university are actually quite different from that for a K-12 system. And we've been working very closely with Rob and his team, as well as our community partners over the course of the past weeks, and are tightly involved and supportive of the process that's being followed as we address these challenges and take the appropriate actions. I will also, as Brian echoed, I will confirm, having 3 kids in the public schools, that the hand washing techniques are being very thoroughly taught. I've had some good coaching as well from my 3, so thank you to Rob and his team on that. And I want to acknowledge that this global situation has caused anxiety, stress, uncertainty, of course, in our schools, our workplaces, in our homes. And I want to start my comments by expressing my deep gratitude for the tremendous work of our colleagues here in the community, and of course on the University of Montana campus, from our facilities staff who are working tirelessly to keep our campus spaces clean, to our frontline staff fielding questions, to our faculty and staff who are working hard to ensure that learning can continue for our students. Over the past several weeks, leaders from across have been meeting regularly to prepare for this situation. We've been developing plans, revising those plans as necessary as new information becomes available. We've had great involvement from our shared governance groups, our faculty, our staff, our students who've provided input, support, expertise, advice, and most importantly, a collaborative spirit of shared problem solving. This has been very important for us through this process, and it'll be very important as we continue. As others have echoed, our first priority is the health and safety of our campus community, as well as the larger Missoula community, and all of our decisions are made through that lens. As Ellen shared, completely preventing COVID-19 in our community may not be possible, but we have the ability by taking proactive steps to lessen its spread and its impact. And we are taking those proactive steps, primarily with the goal of reducing to the greatest extent possible unnecessary aggregation of people in groups. As many of you saw yesterday, we made the decision to move to remote course delivery starting on March 23rd after spring break. We've been preparing for this contingency over the past several weeks, and I'm grateful for the creativity, the thoughtfulness of our faculty and staff, and their commitment to our students' success. We've also canceled or postponed large university-sponsored events on our campus, such as this weekend's Buddy DeFranco Jazz Festival concert, the final performances of our students' excellent production of the play Spring Awakening. We're also moving to curtail education abroad programs at this time. And as you likely saw, we made the decision as the presidents of the universities that comprise the Big Sky Conference to cancel our basketball tournament yesterday, as well as to suspend spring sports competitions. As Rob said, these are not decisions that were taken lightly, and they are tough and they impact our students. But we believe strongly that by being proactive now, we can have an impact and significantly improve the outlook for our community, prevent a scenario in which our healthcare systems are challenged or overwhelmed. And I want to make it the point that while it's important that we minimize aggregation of people into large groups to the greatest extent possible, we are working hard to make sure that our students can continue to make progress in their academic programs and achieve their learning outcomes. How we do so will, of course, vary by program specifics, and we're working to be as flexible as possible to support the continued learning, teaching, and great work that happens on our campus. Our faculty members are in touch with students in each of their courses and will continue to be so over the course of next week as we get ready to begin remote delivery on March 23rd. It's also important to emphasize that during this challenging time for our community, critical services on our campus remain available. To be clear, campus remains open. Residence halls, dining, other campus services are still operational. We're working to reduce the spread of infection, of course, but we also must work to continue that our students and members of our campus community can meet their basic needs. Obviously, as this situation evolves, we will remain in close contact with our partners. We'll continue to share with our campus community the plans we have. We will continue to surface new information, receive questions that help us adapt those plans, and provide frequent updates. In closing, as I'm the last speaker, I want, if I could, to reiterate an important point that we've made on our campus over the past couple of weeks, and I think it bears perhaps repeating for our community, and that's that as we navigate these challenges, I think it's really important that we continue to act in accordance with the values that embody our University of Montana family, as well as our Missoula community. You know, we all realize that fear and anxiety exist. Of course they do. But it is very important that we work to disrupt incidents of bias, racism, or xenophobia wherever and whenever we see them. That will not stop the spread of this virus. That will only make things worse. And as we navigate this situation, it is our duty to ensure members of our community feel safe, they feel included, they feel welcome. That is vital for ensuring a healthy environment for learning and development, of course, on our campus, but also as it's important to who we are as a community. And I think we firmly believe that at the university, and I'm proud of that being a firm part of who we are as a Missoula community as well. You know, this is no doubt a challenging time for our campus, for our broader community, but we will weather this together. It's been an honor for me to be a part of this group of dedicated professionals working hard to serve this community, and you know, these are the behaviors that will carry us through. So thank you.
Before we turn it back to our MC to help manage questions and answers, we are aware that this is a Friday, and we've been operating our information line only Monday through Friday. But with the events nationally, and of course, the communications and messages you'll be sending our community, we are staffing it Saturday tomorrow so that they can call in after they've come home and heard your news and read your paper. And that number is 258-INFO, I-N-F-O, and it will be staffed from 8 to 5 Saturday only this weekend, and then we'll open again Monday through Friday after that. Thank you, Alicia.
Thank you, everyone on our panel today, and with that, we'll open things up for questions. Peter.
Yes. First of all, thank you all for doing this today. I noticed, though, the absence of the two major healthcare facilities in Missoula, community medical centers and the hospitals. Ellen, I wanted to direct that to you. Is there a reason why they're not here?
Yes, they actually are here. They're right behind you. We are working with them. They have taken a great deal of initiative in terms of working together. We are having a close-range meeting tonight, face-to-face, with the 4 largest healthcare providers to see how we can plan in the community for the future to continue to work together. Quite frankly, I hope that my and others' continued mention of their importance and how high they are on our list of supporting and protecting sends that message to them that the only reason they're sitting back there right now is we thought you needed to hear from your local government and school officials, and because it just was starting to get big. So we will be back. We are actively planning, and in fact, this afternoon we will be at the table again.
I'm not sure who to address this to, Ellen or Superintendent Watson. 2 to 5 day closure, let's say that happens. For people who have guardians or students who have guardians or a single parent or a stay-at-home parent, that's fine. What do families do if it's, they're low income, mom or dad has to go to work? What do they do?
Yeah, that's an excellent question, and something that I think we have to take into account before we make these sorts of decisions. I was telling the group earlier today that school closure is not an easy decision. We put some of our most at-risk families in jeopardy when we close schools, and we recognize that. What I can tell you is if we had to close for 2 to 5 days, the reason we're doing so is because we're trying to stop the spread among that individual school population. It would be counterproductive to put all those students in daycare or in other situations where they're still in contact with other kids from that school. So we don't have a good answer for that question. We recognize there's a problem, and we're going to have to solve that. We want to be accommodating to our parents and our families, and we'll do the best that we can. As I mentioned earlier, we have contingency plans for still delivering services like school lunch if we did have to close. But it will be a very difficult situation for those families and a hardship. And this is a point in time where we're going to need our entire community to understand that and help us with that. So if we get to that point, it is my hope that employers would understand that we're in a different place. They would be sensitive to that, sensitive to those working parents, and help us work through that. Again, a 2 to 5 day closure, the main purpose for a 2 to 5 day closure is to help the health department identify the close contacts and stop the spread before the kids come back to school. So the best thing to do in a 2 to 5 day closure is isolate the students at home.
And the steps to preserve, like school lunch, those steps include, I don't mean the detail, but
Yeah, we already do some of that during the summer months and the spring break months. We already have plans in place to get school lunch to kiddos and families that need it, and we'll just continue that. We'll go where the kids are, whether that be neighborhoods or have sites where families can come and pick up the lunch.
Yesterday I spoke with two Missoula area residents who said they had taken severely symptomatic relatives in for testing, and they were turned away, and the impression was that they're just because there aren't enough tests, and healthcare personnel are having to be very stringent with how they're using them. And can you just elaborate on how that triage works and who gets priority for testing?
Go ahead.
So at this point, there are tests available to our healthcare providers, but it is at the discretion of the healthcare provider whether they're going to do those tests. It's very important that in order to not tax our laboratory system by testing people who don't fit the criteria for COVID-19, which is fever over 100.4, cough, and shortness of breath. Those are the three symptoms that are primarily present whenever someone has this disease. Healthcare providers need to be able to rule out other respiratory illnesses. So it's not necessarily that they're being told that they can't get the test, but it is up to a healthcare provider to triage that and figure out if they have other respiratory conditions that might be contributing to their illness rather than going straight to a COVID-19 test. We are in cold and flu season, so that's why that is important. If it was summertime, we would probably have different protocols in place, but right now we've got so many other respiratory illnesses going through our community that we do need to rule out some of those other illnesses before they go to the COVID-19 test. If a provider does decide that their patient fits the criteria, they call our infectious disease nurse that is primarily in charge of the COVID-19 routing through the system. They give the information to our nurse. Our nurse calls up to the state health department and lets them know that information, and then gets the provider in touch with how to get that lab test run. So that's the protocol right now. I do expect that protocol is going to open up as we start seeing more and more cases and as more testing becomes available, where they will not necessarily have to go through the Department of Public Health and Human Services to get approval. But for right now, that is what the protocol is.
So this is for the health department. I would say across the country, we're one of the only.
I can't hear you.
We're one of the only states that doesn't have a case yet. So I think it's benefiting us in time for preparing. And a lot of the hospitals across the country are running out of beds and ventilators and things like that. So have you guys talked to the hospitals to work to make sure that they're prepared for that to occur?
The hospitals and the major primary care providers, I don't want to give you this short list and leave anybody out, but we have an incredibly regionally strong healthcare center. And so Providence St. Patrick has already dealt with the influx of COVID early on, and they are actually moving lessons learned and protocols and things right into the system. Community Medical Center has adopted for use in there. I hope, I do not want to misspeak, but I've met table to table with them. We're going to do that again. They are trying to coordinate the message, the protocol, how to triage people so that we don't mix people who are ill with any respiratory disease with people who maybe just be there for a regular appointment. So they are working collaboratively. So Community Medical Center, again, our other hospital, but also has primary care, has adopted those protocols. Western Montana Clinic is working very closely with them about what they can do in terms of their facilities, the types of people they see. Of course, they don't have their own hospital, so there are some differences. Working together there. Partnership Health Center also is a major primary care provider, and in particular, primary care provider for folks who might otherwise not have access. That is the fourth major partner at that table. I was invited into their group to speak with them 2 weeks ago, and they already had those plans in place. They are adjusting them regularly as testing becomes available. They are working with us so that they can continue to move forward and adjust, protect their institutions, provide the testing, and actually do some of the testing that we in public health need. We need tests of people who aren't that ill. That's called case finding. And as they expand and work with us as tests become more available, those protocols will be adjusted so we can do more case finding, and then we identify more people that we know for certain who have been exposed instead of maybe have been exposed. And so that's actually one of our conversations this afternoon. How can we do that? What lessons have they learned so far? What did they learn on the West Coast? And how will that work for those major providers? And I want to compliment those 4 entities and others for already taking that cooperative initiative.
Is there any plans in place with the Properello Center, the homeless population, the event that turns up in the shelter, social distancing is almost impossible there, Mountain Line as well, mass transit, things like that, coordinating there, and what are the plans?
Yes, we are working closely with them to identify other resources and to identify at what point we need to change our protocols. They are putting some other protective measures in place at this time, but yes, I'm working directly with those community partners specifically.
I will say that it is, not having had large pandemics like this, the good news. There are some facilities and practices that were used long ago that we can't use, or facilities that don't exist anymore. So the state health department and the state disaster and emergency team that the governor put together is well aware that if we need perhaps quarantine anywhere in the state, let's just give you an example of a busload of tourists going to Yellowstone, and that somehow that group was exposed, not maybe exposed, but you get certain information, where do we put them? So we always have the question for the homeless. So maybe COVID, makes that worse. Maybe it helps with some of the creative solutions everyone's been working on. But those types of facilities, in the old days they could quarantine people together, but that's not a good idea. You can put people who are sick together. So in a hospital, for example, if they have 4 COVID cases, I'm not saying they would do this, but they actually could be in that same area of respiratory protection because they already have that disease. When you're quarantining people, you don't want to put them in an area and all together unless you have proper separation, proper protocols to bring supplies clean and dirty in and out. Those types of institutions, that we could just take over, we're talking about creatively what we could do, but the state as a whole do not have those types of institutions available. We met with the detention.
Yes, I've been working with the detention center as well, just to talk about protocols, things that we might do, what would happen, how they can keep it from getting into the detention center in the first place, as well as what they can do if it does get in, and how to keep other people from contracting it. So we are actively working with the detention center on that.
I'm kind of curious, is mainly watch, especially as health professionals, and watch what's unfolded, especially in Seattle, which isn't all that far away. What's been kind of your major concern? What are you most aware of, especially when it pertains to services, but also to the public and maybe mistakes or errors?
Well, this is very much, up until just maybe this week, very much messaging and communication, as well as we've all been researching what we should do in our own institutions. But when I watch it as health officer, on the one hand, I see things that, I totally expected to see. But I also watch very carefully how and when certain measures are put into place. And rather than say, well, geez, why did they do that? I'm not going to second guess that, because they're using the evidence that they have available at the time for this disease in their community based on the spread that they've seen. And those are judgment calls, but we do bring evidence into that. We have decision-making processes, and we were glad to see that the things we've been working on locally as local health officers about what our school plan probably should look like, at least for now, that when CDC studied all these, put them together, and gave us evidence-based school protocol, that we are in line. So I don't second-guess it, but I do study it.
And if I could just add to Ellen's answer to that, one of the biggest objectives in our incident command team is that we want to protect the most vulnerable in our population from contracting this disease, which is why we're sending the message of social distancing and hand washing. That is our biggest concern at this point. We know that a lot of people are going to get this disease, and it's going to run its course, and they're not going to have bad outcomes. But we do know that those people that fall into the highest risk categories, the reason they're in those risk categories is because they're in the highest risk of contracting the disease and having bad health outcomes due to that. So that is our biggest concern, and that's why we're working so diligently to spread the message of social distancing, hand washing, making sure that people who do fit those categories are actually taking it upon themselves to choose not to put themselves in large crowds or other situations where they could potentially be exposed.
And what we don't know about contagion, but take care with, because they can have perhaps in any disease contagion before symptoms arrive. There's no certainty on this, but we assume there could be. But we do know that when someone does have active symptoms of coughing, that is the most contagious period.
But is there any thought going around of possibly canceling the Missoula St. Patrick's Day Parade?
No, I have been question. As of yesterday, Butte wasn't going to cancel the St. Patrick's Day Parade for a lot of good reasons, so that is interesting that they did. But they have a lot more incoming into their community than Missoula has. But also, an outdoor activity that is voluntary that you can or cannot go to is really not the biggest risk of whatever risk exists tomorrow. If you're going to look at, wow, St. Patrick's Day is a really bad day, well, for where we are right now, not necessarily so. And there's a lot of indoor gathering in numerous establishments and homes. So if we want to look at, what are we going to do about St. Patrick's Day, I'm not sure that the parade itself would be the most risk-filled event.
President Butler, if I may ask, I know that the Big Sky Conference basketball series has been canceled. I asked the sports information director about football practice, close personal contact there with a lot of individuals. Is that going to remain?
Thank you for the question. And that is, as we said, we've suspended our spring sports seasons, and we are evaluating, practices and other workouts for each of the sports on a case-by-case basis. We're still frankly working through some of those things right now about what those criteria are for what activities can continue, what we might want to curtail. So we're working through that on a case-by-case basis right now.
This is for the two educators, Superintendent Watson, President Walker. Spring break, a couple thousand people might be leaving, students and their families might be leaving Missoula, which so far is not that case to other places around the country and the world. When you guys view the next week, are you expecting, what are you expecting on that? How are you going to be monitoring your students and their families when they eventually come to school.
Thank you. You know, from a university standpoint, that was a key consideration in our decision from a remote education standpoint in terms of how we're going to continue to monitor our students. You know, this is, yes, there is perhaps enhanced travel during spring break, but we also have, over time, over the past months, you have students going on trips, you have families visiting their students here in town as well. So we're going to continue to take the measures that we have and working with our local health officials and making sure that we continue to follow those protocols to watch for those potential instances of risk, and that we we enact these measures that we mentioned to minimize aggregation, unnecessary aggregation in large groups.
Yeah, the only thing I would add is we will continue the same advice we've been giving our families for a long time, but reiterate staying home when they're sick, especially after spring break. We have a fairly good chain of communication that typically starts with our school secretary when a parent calls in, and they get our school nurse involved, which can have a direct line to the health department. So if we have a sense that there could be somebody that has come back from someplace and they are sick, we will funnel that information to the health department.
John, you mentioned that first responders still doing what they do. Are they going to take any extra measures for protective gear or in certain response situations or anything like that?
We do have personal protective equipment for those first responders, and they'll deploy those based on standard operating procedures. Yeah.
I'd like to ask what measures, if any, have been taken with regards to nursing homes, as they're kind of often cast as the most at-risk groups. I've spoken with several of them about measures they're taking voluntarily, and I'd like to hear what's being done at the government level to regulate and or support them.
Yes, we are actively working with our long-term care facilities and home health to make sure that they are implementing the protocols that are recommended. Some of those protocols are going to include not having their nursing home or long-term care facility open to public visitors, and that is something that we are recommending at this point. We are also talking with home health aides and people who, like aging services, who provide Meals on Wheels, to determine what their protocols are. So we are actively working with those groups. We recognize that the long-term care facilities and people that are patients in the home health agencies are at a particularly higher risk, and they do have guidance from the CDC on that, and we are actively working with them to implement that guidance.
You said the number of testing kits, the supply had loosened up a little bit. Can you specifically do that?
Yeah, so the State Health Department last week had let us know that there was only 200 tests that were available to the state. This week, they've said that they have well over 600 tests, and that they have no doubt that they can actually get more of those tests now. There are 2 private labs that also are available to do the testing. There is one little caveat to that. The private labs, it takes 5 to 7 days for those test results to come back. When we use our state health department, we have results by the end of the next business day. That affects our families and people in our workplace, because we have to have them isolated until we get a negative test. So for those kids who are in school or people who need to be able to return to work, it's a lot easier if they can get back to work or back to school by the end of the next business day rather than 5 to 7 days later. So we are still encouraging that people use our state lab for the testing, just for the ability to get those results back a lot faster. The testing kits are out there. They're all across the country. There's now more reagent than there was. The other thing that they've opened up is that you don't have to have that. Last week, it was required that you had to have some sort of travel to an area that was experiencing spread of the disease in a community setting, and that is no longer a requirement for people to get tested. So that's another way that it's opened up.
Follow-up question. Yesterday, Governor Bullock announced that the state had capacity to test 1,000 people. You just said it was 600. Can we clarify here at all?
Yeah, so when I had our conference call with DPHHS about the numbers of test kits, that was Wednesday, so they probably do have over 1,000 now.
Okay, well, that concludes our session for today. Before we leave, I just want to give a few reminders regarding public information. This is an evolving situation, and we will be updating information on a routine basis. For the most up-to-date information, please use our website, which is missoula.co/cvirus. If you cannot find the information that you need there, please feel free to call our helpline, which is 406-258-INFO. We will have the call center staff tomorrow, as Ellen mentioned a little bit earlier. Another thing I'd strongly encourage folks to do is to use, when you send people information from our resources, please send them a link to the site or a link to the resource. Please do not copy and paste, as things, again, are constantly evolving, and we want to make sure that people have the right information at the right time. With that, thank you to everyone for coming today and for participating. Have a wonderful rest of your day.
All right, thank you. I don't even, no. We wouldn't have, oh, I know.